Welcome to the City Show's coronavirus update, COVID-19. I got caught in the middle there. It is March the 27th. We have the updated numbers. As I start my day each day, my wife takes my temperature. Today it was 97.7, so it looks like I beat the coronavirus another day. I get to the studio, I disinfect all the cameras and keyboards and all that stuff, trying to do as much as we can to keep the employees at Hudson Media healthy and safe. We're trying to do as much as we can remotely when possible. The problem is we need somebody in the studio to bring in the remote cams. Yesterday we did the mayor of Toms River. He did a coronavirus update, and we did a pretty good, with the equipment we have, we do a much better job than somebody with a little webcam. So the upcoming week, I'm going to start reaching out for some of our movers and shakers here from the municipalities and the hospitals and see if we can bring them in for a couple of minutes and really crank up the coronavirus update. We are number one now globally with the coronavirus. We have passed Spain and Italy and China. For that matter, when we get to it, it's interesting when you look at the spread of the coronavirus globally, but I'll get into that later. Worldwide, there are 552,943 cases of coronavirus. There have been a recovery of 103,736. There have been 128,706 deaths attributed to the coronavirus. But again, everybody had some underlying medical condition. The active globally, there are 378,930 cases. 95% of all the cases globally are categorized as 95% mild. Not mild. 95% of all of them are mild. It did tick up one, for the last week or so, it was 4% was serious. Right now, it is 5% serious, and of that, there are 21,062 serious cases worldwide. The United States, now this is a fluid number, this is up to date as me sitting down here, was 86,043 cases. And keep in mind, we have a population, which I double checked, is now 331 million people. Really, it's like a fraction of our population. In the United States, 333 people have recovered. 1,304 people have passed on. Let me show you something. First, let's show you the United States map, John. There's the U.S. map. You can see the epicenters. Yeah, it's interesting. Washington and California, their red dots have gotten smaller. New York and New Jersey have gotten quite larger. New York City is the epicenter. In New York City, there are 23,112 cases. New York State is 37,258. Now, you start to study the map, and I know there's people far smarter than I who can figure out what this map is telling, but it's interesting when you look at the global map, and we try to squeeze it in on the screen here. John, the global? Now, again, we kind of condensed it there. The dark spots are the areas with the coronavirus, the hardest hit. Russia's okay. You notice China's okay. You got France, Spain, Italy, the UK, the United States, Alaska, and just a small portion of Canada, which is their port area. I'm trying to figure out how this virus became a global pandemic. So I was thinking at first cruise ships, until I looked at Iran. You see all the way to the right there, that's Iran, and they're in the dark. Nobody's taking a cruise to Iran. So that started to make me think about oil. That's probably how this all managed to go globally. Oil deliveries, oil pickups, sailors getting infected, coming to the metropolitan areas, because when you go around to the middle of the United States, there's cases, but nothing like New York City, nothing like Washington, nothing like California. All right, drop the map. But my opinion, I think it was spread globally by oil deliveries and oil pickups. All right, where are we here? New Jersey. New Jersey has 6,876 cases. We have 81 deaths statewide. Remember, we have approximately 9 million residents in New Jersey. So again, it's not a large percentage. Hudson County, my home county, has 441 cases. Ocean County, where our other studio is, has 389 cases. And Bergen County is still leading the state with 1,206. Now, there's testing going all over New Jersey. There's testing sites popping up. There's 2 in Jersey City. We'll get to that. The more you test, the more positive numbers you're going to get. So let's not get too alarmed. But what is interesting with New Jersey, our positive test results are coming in at about 31, almost 32%, 31.7%. That means 68.3% are negative. So these are people going to the testing sites that were negative. Again, no symptoms, don't go for the test. There were 19,364 tests performed. We are testing positive pretty much the same rate as New York City, in the 30%. And that's because of our proximity to New York. New York State, like I said before, is 37,258. New York City, 23,112. The rest of the United States are, they're testing at around 4%, 5%. It's the epicenters. And unfortunately, New Jersey is going to become one because of our proximity to New York City. The communities that are near the path, the Holland Tunnel and the Lincoln Tunnel, they have to really be concerned. Jersey City, we got the path, you got the Holland Tunnel. North Bergen, you're near the Lincoln Tunnel. Union City is near the Lincoln Tunnel. And of course, the GW bridges are not far away. Rhode Island, the governor of Rhode Island, anyone who's traveling from New York City needs to be quarantined for 14 days. And they will have the National Guard and state troopers make sure that you do. These at Florida, if you fly into Florida or drive into Florida, you got to self-quarantine for 14 days. If you use mass transit, especially going into New York City, if you're taking the path, you're taking the New Jersey Transit in, do whatever you have to protect yourself. The mask, the gloves, it's impossible to distance. Hopefully, you're not taking the mass transit. It's unfortunate everybody's being laid off. But in that case, if you're taking mass transit, maybe it's better off you're not, because those are coronavirus tubes, buses and the trains. Testing centers, they're popping up. You got the one at the PNC Arts Center. For that matter, I came from the Seaside studio this morning. There was nobody there. The cones were up, but I didn't see any cars backed up. Bergen County Community College. By appointment, Hudson Regional Hospital in Secaucus, Riverside Medical Group in Secaucus on 10th Street. Newark, you got the testing center opened on Thursday, Weirquack Park in Newark. William Patterson University at Ahern Stadium in Bayonne. Bayonne Medical Center is doing the testing there, and Mayor Steve Fulop has opened 2 sites in Jersey City. He wasn't waiting for the state anymore. They're by appointment. One is at the Fire Corps headquarters on Marin Boulevard, the fire department headquarters, and the other one is at the old DPW on Route 440, down by Culver Avenue. That's a drive-through. The one on Marin is a walk-up. You don't have to have a car, but the one on DPW on 440 is a drive-through. Can you show the Jersey City notice? You got the phone numbers. You follow Fulop on Twitter. Here we go. That's Steve's notifications and locations. The phone number is there. So if you need, call for an appointment, all by appointment. They don't want a long line of people on Marin Boulevard or a long line of people on Route 440. For that matter, let's go over the symptoms. No symptoms, no test. Runny nose, sore throat, a cough, a fever, difficulty breathing. Other symptoms are loss of appetite, loss of taste and smell. If you have that, you don't see the loss of taste and smell on there, but that's a recent addition to our symptoms. And if you have blood type A, take every precaution you can, because it looks like you're more susceptible to the coronavirus than somebody with O positive or O negative blood. For that matter, if you have type O blood, do some shopping at ShopRite for the people with type A, because they really should avoid going. Today, Mayor Fulop had the press conference there at the DPW, the former DPW site in Jersey City, and interestingly enough, he started coughing. Hopefully, Mayor Fulop does not have an issue. He's got a young child at home. There is talk, Governor Murphy talked about mortgage grace periods, mortgage delay payments. Well, you see, you can't have a rent delay without a mortgage delay, and the problem with mortgage, and he's talking to the banks, but you know what? The mortgage payment also includes real estate property taxes. That becomes the problem. Do we do a waive for 3 months on mortgage payments with the real estate taxes? And in some cases, your insurance is part of your mortgage payment. There's a lot that goes into it. April 1st is coming, and that's when things are going to get interesting. You know, this kind of hit us in the last 2 weeks after you paid all your bills from the beginning of March. April 1st is coming. A huge amount of people are out of work. 1 week, the number of applications that they could get through unemployment, they actually able to process them, was a 1,500% jump. Governor Cuomo in New York State is questioning shelter at home and self-quarantining because one person in that house, everybody's in the rooms together, could be affecting everybody in the household. So he's questioning, and he might be right. Self-quarantining isn't the right idea, I believe, because you got everybody locked up in a house. For that matter, our health director here in New Jersey stated that everybody will get the coronavirus. So if that's the case, then why are we closing all the businesses and why are we doing the self-quarantine if we're all going to get it anyway? The Javits Center is now a hospital in New York. The federal government and the Army Corps of Engineers have converted it into a hospital. Good job by the feds. They're getting equipment out. The FEMA's doing a great job. It really kind of snuck up on us in the last 2-3 weeks. I hate to say it, but I guess it snuck up on the feds too, even though we kind of had warnings about this. All right, that's everything we got for today. Stay healthy. Distance is probably the best thing. Try to keep that 6 or 8 feet. If you're in ShopRite, you can do it. You can handle the distancing yourself. If you got the mask, wear it. You got the gloves, use them. Stay healthy. I'll talk to you later. Good night.